Hello, everyone. Today we are going to talk about preventing pelvic tilt. This issue has become very common, yet many people do not fully understand its true nature. In general, pelvic tilt is a functional dysfunction of the musculoskeletal system. It reflects a difference in how the left and right legs work, how you push off the ground, and how you bear weight on each side. Visually, pelvic tilt can be noticed by a difference in the height of the front pelvic bones, but the main functional problem actually lies in the hip extension range. The side of the pelvis that sits lower usually loses the final phase of hip extension during walking. As a result, instead of extending the hip properly, the body compensates by overusing the lower back on one side more than the other. This imbalance is difficult to notice because we spend a lot of time sitting and often have poor awareness of the abdominal muscles. However, there is a simple exercise that can be added to your daily routine or used at the beginning of strength training to help monitor and prevent this condition.
Exercise. The exercise is performed while lying on your back. When pelvic tilt is present, the weaker side, where the pelvic wing is lower, usually shows reduced hip extension at the end of the movement. Our goal is to check and improve this final part of the range of motion. In most bilateral exercises, it is difficult to control this because the lower back easily compensates. That is why this movement is done unilaterally. Lie flat on your back. You can start with either leg in order to compare strength and movement quality. Pull one knee toward your chest, holding it with both hands, and bend it until you feel the lower back begin to flex. If you feel discomfort in the knee, this is not a problem. You can hold behind the knee or use a strap, especially if body position makes it difficult to reach comfortably. From this position, extend the other leg straight so that the big toe points upward. Keep your head and torso relaxed on the floor, with the shoulder blades gently drawn together. Begin pressing the heel of the straight leg firmly into the floor, as if you were trying to lift the pelvis off the surface. Hold this effort briefly, then relax. Repeat this movement several times. If you feel discomfort in the lower back or under the knee, that is acceptable. You can adjust your position by using the bent leg like a joystick to fine-tune pelvic alignment. For example, if you feel tension in the lower back, pull the knee slightly closer or move it outward. If you feel discomfort in the straight leg, rotate the bent knee slightly inward. This helps stabilize the pelvis in the most comfortable position for you.
Conclusions. It is important to test both legs and compare how strongly and evenly you can push through each one. If you notice a clear difference, focus on the weaker side for several weeks by performing this exercise in multiple sets with short holds. If you participate in strength or complex movement training, add a few sets at the beginning of your workouts until strength and extension feel equal on both sides. For preventative purposes, this exercise can simply be included in your warm-up or morning mobility routine. It requires noticeable effort, so do not be discouraged if you are unable to lift the pelvis at first. This is normal. Ideally, the goal is to achieve at least a minimal pelvic lift using each straight leg separately. Despite the difficulty of the exercise, remember that the leg is a primary support structure. It must be strong in order to remain healthy.